So, Richard, I'm going to hand over to you because I think you know Dr. David Unwin and Dr. Jen Unwin, and I don't.
So I've, I did a podcast and had the pleasure of meeting Jen in the PHC conference. I didn't get a chance or the pleasure to meet David in person, but hello both. Welcome on board. Thank you so much for coming on. Jen and I recorded a podcast recently on food addiction, which is one of the things that we wanted to go into detail today, amongst other things. But look, thank you both so much for coming on. Huge pleasure to get you on here. It's been, how long have we been? 9 hours into the 24-hour live.
Oh, I was wondering if we were at the tail end or at the beginning. So you're just getting in your stride now. 9 hours.
Yeah. That's it. Yeah.
Amazing. You crazy guys.
Yeah. Do you know, initially we were concerned that we wouldn't have enough content. But it looks like we're running out of time with the speakers. I don't think I think we should have allocated more time, but yeah, 9 hours and counted. Do you both know Stephen?
No. Hello, Stephen.
Hello, Dr. Jen, and hello, Dr. David. I mean, I know of you two, and I'd love to get you onto my podcast. I'm a specialist practitioner in diabetes and obesity. The diabetes thing, I love the sugar infographics and all that sort of stuff, which is great. Obviously disappointed David hasn't got his bow tie on, but because I was expecting that today.
Yeah, expecting the signature bow tie. We've just been next door. It's our neighbour's 50th wedding anniversary, and we were like, oh, we gotta go.
Oh, I appreciate it. I thank you so much. I just had this crazy idea that we might be able to spread the word by doing something unusual, and it just had a ring to it, a 24-hour live stream, the biggest conversation about keto, low carb and carnivore. It just seemed to get people's interest. At 9 hours.
We're the only people with enough energy to do it.
Exactly.
Well, that's true. Yeah, in fact, that's the first thing. We opened with that, saying that when we were high carb, if we were trying to do something like this, we would be thinking, oh, we've got to eat 3 times a day. Oh, this is no good. We've got to have breakfast, and we would have panicked trying to do 24 hours. Literally, I have a little sort of selection of stuff there to possibly eat, and I haven't touched it once. It's incredible. Yeah. And you're right. This way of eating definitely does that. I'm going to hand over to Rich because for the viewers that don't know you, we do need a little bit of an introduction of what Dr. Jen and what Dr. David do.
Yeah, fantastic. I mean, Stephen has kindly written introductions for everyone, but we've been handing over to the guys. So would you both like to introduce yourselves and give us a little rundown on what you guys do?
Yeah. Do you want to go first, David?
I was in the back. I've opened my mouth now, so I'll carry on. So I'm a GP from north of Liverpool, and I'm really interested in what are the true causes of the chronic illnesses that so many of my patients have. Why are they ill? And I realize now that I didn't show much interest in that. I lacked curiosity about why are people ill for the first 25 years of my practice, and I defaulted data medication far too often. Now that I've really got into why are people ill, I'm discovering that lifestyle is often at fault. And if you change lifestyle, we're not using drugs. Specifically, I'm obsessed, and that isn't too strong a word, I'm obsessed with helping my patients with type 2 diabetes control their diabetes or get into remission without using drugs. And I look after the physiology side of it, and Jen will talk to you about the psychology side of helping people change behavior. And we've been doing it for 10 years now in HS practice, and we've published a lot of papers. We go all over the world spreading the word. And arguably, we've now got the best results of any clinic in the world. And this is in an NHS clinic looking after people with type 2 diabetes. So this week, I saw my 130th patient that's achieved drug-free remission of their type 2 diabetes. And it just gives us such joy and such pleasure. And we hadn't seen remission of diabetes, drug-free remission definition of diabetes. I hadn't seen it once in the first 25 years of my practice. And now we've seen it 130 times. And it just, get back to what I said at the beginning, really, if the problem with diabetes is a high blood sugar, it seemed reasonably logical to think, well, where did that sugar come from and could I have eaten it? And that's the basis for us of the low carb diet that we use. So it's in 10-minute appointments we're doing this, but we also have run group consultations for 10 years. And that's a new for me in general practice. So I think that's enough from me now. Jen?
Yeah, you're a bit fuzzy as well. We can't hear you very well.
We've got a thunderstorm here, so it's yeah.
But maybe it's just over you then. Anyway, so
Jen's feed seems fine.
Yeah, mine seems fine. Yes, so I'm Dr. Jen Unwin. I'm a clinical health psychologist by background. So I've always worked. I've retired now from the NHS, but I was in the NHS for all my career, helping people with chronic conditions to live as best they could with those conditions. So it might have been chronic pain or some sort of disability or disfigurement or some sort of life-limiting condition, and helping them to sort of live their best lives with whatever that condition was. So I was always really interested in motivation and behavior change and hope. So hope was my big topic, and I did my doctorate on hope and the difference that hope makes to how people adjust to physical health challenges. And to be honest, hope makes such a massive difference. It even makes a difference to how long people live. So people who are more hopeful and who take more steps towards sort of their goals and their best hopes are actually more likely to live longer, to take less medication, to consult doctors less often, etc., etc. So it makes a big difference. So that's the psychology side. And then, as David said, about 11 years ago now, we just thought it would be nice to work together. We haven't put our skills together and worked on anything before then. And I just recently found low carb. I'd struggled all my life with weight and so on. And I read Dr. John Briffa's book, Escape the Diet Trap, that some people will have come across. He was also a British GP, but he was one of the first to sort of talk about low carb in this country. And so we thought, and it worked for me, so we thought, right, we're going to try it. We could see how it could work. We're going to try it with David's pre-diabetic patients, because there were just more and more of them, and they were just getting sicker and sicker. And the first 18 patients we wrote up for for a research article, and it's just been going on ever since. The rest is history.
Practical diabetes.
In practical diabetes. And then I also realized that low carb ketos, it's fantastic, but it's kind of, yes, if people stick to it. And people like me with food addiction problems and body weight problems often have problems sticking to a low carb diet, even when it's worked fantastically for them, or they felt amazing on keto. We've got all those benefits that you've been hearing about in the last 9 hours, and we even know that. Then some of us really struggle to stick to that lifestyle. So I started getting more and more interested in that, and wanted to really understand this thing that that looks like an addiction. It quacks like a duck and it walks like a duck. It looks exactly like an addiction. People who, still craving foods that, they don't actually want to be eating, are losing control of eating those foods and continuing to eat them in spite of the fact they know they're harming themselves physically and mentally. And, what else would that be apart from someone with diabetes who continues to eat carby and ultra processed foods? It's kind of a form of self-harm. So I'm just super interested in that, and that's what I've been concentrating more on in the last sort of 4 years or so.
Love this. Fantastic. And an incredible comment there. Incredible 130 lives. That should say saved, I think, opposed to changed. I mean, because that's exactly what you guys are doing, is saving lives, isn't it? And unfortunately, I mean, there's this common disassociation between carbohydrate and sugars within the community. You know, we view carbohydrate and sugars as being two different things. They are one and the same. Carbohydrates break down into sugar, and unfortunately, within society, people who are consuming lots of bread, pasta, cereals, are unknowingly consuming high quantities of sugar, as well as damaging lectins and phytic acid and things. But circling back to a comment you just made there, so you, Jen, were the catalyst that began all of this in the first place, which I wasn't aware of. So fantastic, brilliant stuff.
Yeah, so I mean, it's like that. I don't know whoever said it, but I love it. Is to make your mess into your mission. So, you know, it's that thing of, if you've struggled with something and you've tried to understand it, and you've actually, you know, you feel that probably through that struggle you can help other people to live a better life. You know, I think there's nothing more rewarding than that, is there? And to carry on learning and helping more people, it's very, very rewarding. And we get to, what's lovely is that we get to do that together. You know, it's not, we had two separate careers, but now, as David says, you know, we get to speak together, and people invite us to go all around the place speaking. So what could be nicer?
Yeah, fantastic. And I think, you know, we're all in a similar boat in that regards. You know, Stephen and I, we give up much of our time for free to do lives every Sunday, free coaching, public speaking events in regards to spreading the word. I mean, I think, you know, we touched base on it earlier, Steve, wasn't it? That we feel that we found a secret, and we're trying to spread that secret to as many people as we can. You know, during our podcast, you know, I mentioned to you that I used to be a type 2 diabetic, clinically obese, suffered with depression, anxiety, arthritic pains, daily debilitating migraines that would make me blind, for which I was on 3 different medications for. I was unable to walk up my stairs without stopping or being severely out of breath. And from changing the food that I put into my mouth, I didn't only reverse every one of those things. I lost 107 pounds, reversed the diabetes. I went on to become a professional champion at a pro level, a European champion. And this is all down to diet and lifestyle. And you know, similar situation, my wife and I have sold 3 houses to put into the business where we try to re-educate people. And this was the whole idea behind this live, this crazy idea that Steve came up with, where we go live for 24 hours, which I'm sure he's beginning to regret now 9 hours in. But no, fantastic, you know. And coming back to something you said there now, I mean, it's food addiction, and something you told me during the podcast. Food addiction is not a recognized illness within the NHS. Is that right? So we've got alcohol addiction, drug addiction, gambling addiction, but food addiction is not recognized.
Yeah. So at the moment, obviously, you can't, because it's not recognized here or in the state, anywhere internationally, even in the US, although they're probably a little bit further ahead than we are in sort of acknowledging that it may be a problem. So of course that means, because it's not acknowledged, there's very little research being done, and there's very little indication about, you know, how you effectively help people, and therefore there's no help. We think that conservatively, I mean, really conservatively, 10% of the population probably have this problem. A bit like, you know, all of us drink alcohol, but not all of us develop a kind of clinical problem with alcohol. The same with food. A lot of us eat these kinds of foods, and many of us struggle, you know, to resist them. But there is this group of us that you know, really have this really addictive sort of relationship with processed foods, and particularly sugars and carbohydrates. So 10% would equal about 4.5 million adults in the UK. Wow. So that's 4.5 million adults who are doing themselves harm on a daily basis, don't know what to do with themselves, you know, struggling. And if they go and see their healthcare practitioner, unless they're lucky enough to live in Southport and they get to meet David, those healthcare practitioners wouldn't know what to do with them. They wouldn't probably ask about it. They wouldn't know where to refer them. You might get sent to mental health services, but they wouldn't have any idea how to treat you. You know, even the addiction services, they're not going to be interested because they only treat alcohol and, you say, like drug addiction, these other addictions. So it's a sort of hidden sort of emperor's clothes thing. Like if you ask the public, is it possible to be addicted to certain foods, they're going to say yes, but then there's no help for people, or, you know, you're actually kind of laughed at if you say that certain foods are addictive, and people say, oh, food can't, you know, how can food be addictive? We have to eat, kind of thing. So we do have, of course.
I think one of the things is shame, that people in every clinic I do, I'm discovering people who they know they are a carb addict, but it's the shame. They say it's so ridiculous, I can't give up bread. In fact, bread is one of the foods that I eat most. And here's a funny thing: I never found a single bread addict in the first 25 years. But if you never ask, you never will find them, because they're so ashamed. Yeah. And they nearly all cry when they tell me, because they sound so ridiculous. It's almost a relief when people understand why they're behaving in this odd way. Intelligent people eating stuff that's shortening their lives. And it's a great pleasure, really, to help people with that, in terms of at least they know they're not mad. They get that. Sorry.
Yeah, I think it's the big problem is they blame willpower. You just lack willpower, which is absolutely ridiculous to say. I mean, I've never met anybody that smokes for their health, and I've never met anyone that smokes and says, I'm just choosing to smoke. You know, and it's the same with this carb addiction. There are people that say to me, I know I shouldn't eat bread. I know I shouldn't eat donuts. I just can't stop myself. And it is just an addiction.
That's right. They can't, because they're driven. The primitive brain is driven to, you know, to kind of stop you starving, basically. And it's, you know, you're driven to eat these foods, even though when the frontal lobes are telling you you don't want to eat those foods, but your hand reaches for the foods. It is the most incredible process, and of course, you know, makes you feel like you're a bit bonkers if you don't understand that mechanism. And so, as David says, people kind of hide it. They're ashamed that they can't control themselves. Also, there's the kind of denial factor, because although we know we should give up our foods, the thought of, and David will tell you this, the thought of giving up the bread or the chocolate or whatever it is, which is kind of your best friend. Well, it's not your best friend, is it? But it, you know, life without those things feels incredibly, you know, it just feels impossible as well. So people are often in denial about the harms that are happening, and also they don't know what to do anyway. So they just sort of deny it's a problem.
Yeah, and again, I mean,
another supplementary point I'd like to make is that, you know, I can help patients with cigarette addiction, with alcohol addiction, and even gambling. There is no substance. So I can refer you for your gambling addiction, which is very serious and ruins lives. And yet here we have this thing which is affecting so many people, and we're denying that the condition actually exists, so that there is no help for any of those people, which is a real tragedy. But it is shortening lives, it is killing people. And I'm so mystified how I missed it 25 years. And it's such a tragedy that many people are suffering privately and secretly. And there's nobody they can tell, and any doctor you go to is going to say, well, we don't have anywhere to refer you for that. Time to tell them about your book, Jen, probably.
Oh, yes. So I have got a copy here. You'll be able to see. So I wrote a little book in lockdown called Fork in the Road. There it is.
Put it in front of your face there.
A hopeful guide to food And all profits go to the Public Health Collaboration, which is the charity that Rich was at the conference for. And it's just got all the basic things that I'm probably talking about this evening are in that little book. And you'll also be helping the charity that David and I both work for and support to spread, this thing what I was sort of saying about raising people's awareness, spreading the good news, and hopefully soon we'll be launching some courses for professionals to understand the problem, and also for the public themselves. We'll be doing groups and courses so that people can start their journey to recovery.
Yeah, love this. It's fantastic. And it baffles me how this isn't recognized as an addiction, because for me it's the single most detrimental thing within society. It comes back to this name and shame thing, isn't it? We become ashamed of the food we and I've been there. I've hidden the food that I eat, and I know that I'm doing wrong. I'll nip out to or used to nip out to a fast food restaurant. I'd hide the wrappers, and it's this name and shame society where people will just say to you that you need some willpower, but it goes well beyond that, doesn't it? Which is what we touched base on during our talk. It's how it affects the neurotransmitter signals within the brain. These foods block certain pathways, the catecholinergic neurotransmitters within the brain. They block the cofactors like iron, zinc, and vitamin B12, which we need to synthesize things like serotonin and dopamine, epinephrine, norepinephrine. Do you want to go into a little bit more about that in regards to how these foods that we consume are blocking the absorption of these cofactors and the production of these neurotransmitters? Because when our brains, when we're not receiving these signals, we go chasing dopamine, for example, don't we? We're hardwired to chase dopamine, and I think this is a massive contributing factor to this addiction. And it isn't that person's fault. It's about understanding that the food that they are consuming is contributing. It's this vicious cycle, isn't it? That where you need to understand what's causing it in the first place, remove one or two of these offending foods, then our neurotransmitter signals, the catecholinergic neurotransmitter synthesis begins to ramp back up, and we feel a lot better. But we went into a lot of detail in this, didn't we, during that talk? Do you want to expand a little bit more?
Yeah, certainly can do. And someone's just made the comment, haven't they, that the common denominator in alcohol and food is often sugar, and all of these things are operating in the same part of the brain. So whether it's alcohol, sugar, cigarettes, it's all to do with these neurotransmitters. And you're absolutely right that dopamine is a big part of it, and we're hearing more and more about dopamine, aren't we? People are sort of dopamine, that's kind of interesting, and we know it's also involved in things like mobile phone addiction to kind of scrolling as well. That we're all very, we wouldn't be here today if we weren't sort of motivated to get certain things and achieve certain things. That's how we've survived, is being really motivated to find the food that we needed, or to do the jobs that we needed to do during the day to survive. So when we have ultra processed foods, or even just simple sugars and carbohydrates, one of the things that happens is we do get a nice sort of dopamine boost, and kind of we love that, but what goes up must come down, like all things. And the brain doesn't really like these high levels. Like everything in biology, there's a kind of balance in the body. One thing's going to sort of interact with another thing. So when the dopamine goes high for a long period of time, the brain thinks, oh, there's a lot of dopamine slushing around here. We'll just knock out a few. We don't need so many dopamine receptors in the brain. But of course, the problem then is that when you don't have as many dopamine receptors in the brain, in the normal course of your life, when you're not eating sugar, you're feeling a little bit flat, because it doesn't feel that there's enough dopamine. So then you're looking for the next hit to sort of give you another boost, and then the brain thinks, oh, there's another bit of high dopamine, we'll knock out a few more receptors. And it's a really bad idea to not have enough dopamine receptors, because we start to feel more and more depressed and more anxious. And it's been shown in studies that, you know, these high sugar diets do leave you genuinely feeling more depressed and more anxious. So so that's one thing. And then there's a similar path that goes on with serotonin. If you have sugars are high, then obviously insulin's high to deal with the sugars. But when insulin is high, tryptophan can cross into the blood-brain barrier more easily than normal, and tryptophan gets converted into serotonin. So you get a big, nice serotonin high, you feel great. But what goes up must come down. And again, so it's a vicious cycle going in a bad way. It's a trap that's difficult to get out of, because you do get withdrawal symptoms, not physical withdrawal symptoms, but psychological withdrawal symptoms of feeling more low, feeling more anxious, etc. And you have to get through that and out the other side to start to feel better, which is what I experienced all those many years ago. But at that time I was just thinking of it as a sort of physical withdrawal, if you like, which it is to some extent, but it's also psychological. So yeah,
for sure. And to circle back to something you just said about the tryptophan, I mean, the opposite is also true in a state of insulin resistance, isn't it? Insulin resistance and inflammation will block the dopamine pathways, and we're hardwired to chase these dopamine hits. So we end up searching for other ways to stimulate, these dopamine hits, and we get this through sweet foods. Sweet foods release dopamine into the mesolimbic pathway, so we chase these sweet foods, and it can even be carbohydrate from bread or anything. But another factor that is that these foods we are consuming are incredibly high, not just in carbohydrate, but in lectins and phytic acid, which are blocking these cofactors, isn't it? The iron, magnesium, vitamin B12, which we need to synthesize, the tryptophan as well,
exactly.
Creating.
Someone was asking about absorption of nutrients, weren't they? About caffeine. I don't know that much about that, whether that is the case or not. But definitely, yeah, there does seem to be a factor that when you start chasing this high, then people start focusing on chasing that, and of course the other foods drop out of their diet. I mean, I remember this happening to me, where I would just eat pasta and ice cream and pizza, and I wasn't having any foods with nutrients in, because they weren't giving me that kind of buzz. So then you're crowding out the good foods in your diet, and then people they are literally deficient, and they're craving stuff which, they're craving real foods, but then that all gets confused and you end up just chasing these dopamine highs.
Yeah, and so I think also, I mean,
we're overfed and undernourished.
100%.
Yeah, I agree. Overfed and undernourished, and it's worth thinking about the nutrient density of food. It gives you a new perspective on what nourishment means, because it really is not about calories anymore now. I'm just thinking about the vitamin deficiencies we get in the practice. So vitamin D deficiency, very common. Folic acid deficiency. I've stopped measuring that. It's so very, very common. And then iron deficiency itself, internationally, that's a very big one.
Yeah, and again, I mean, segueing from there, we know that processed foods and these sweet treats are bad for us, but then there are groups of people out there who are actively trying to improve their health and well-being. They're eating lots of fruits and vegetables, thinking they're doing the right thing while neglecting animal proteins. So the issue with this is, vegan, and this isn't a stab at vegans and vegetarians. I've repeated this, multiple times today. I work with vegans and vegetarians. I respect anybody's decision in regards to diet and nutrition, but unfortunately, vegans and vegetarians lack iron. We can't get iron from spinach. Popeye was incorrect. The human body needs heme iron. We need this from animal proteins. A vegan and vegetarian diet is lacking in vitamin B12. We cannot get B12 cobalamin from plants, and zinc we're lacking. So these standard healthy diets that people are going on, who are consciously making an effort to improve their health and well-being. These are being counterintuitive in regards to this production of the catecholinergic neurotransmitters, because these are, again, missing the cofactors of iron, zinc, and B12. So even the vegans and vegetarians who are actively trying to be fitter and healthier are causing issues. And I think, did you and I, Jen, or was it another podcast we referenced, I think, a study where vegans and vegetarians have a higher rate of depression and suicide. So, I mean, it all comes back to this food, doesn't it? So it's not just these sweet treats. It comes back down to even the foods that we believe are highly nutrient dense in regards to fruits and vegetables, animal proteins. And I think you guys will agree are the most nutrient dense foods on the planet. And this is what's missing, predominantly from a healthy diet.
From the
that's my
kind of point of view. I mean, certainly the people that we see when we sometimes do weekends where we're actually with people, and we've obviously done all the catering, and we're watching people, choose what to eat, and they so often don't choose enough protein. They don't prioritize protein. Oh yeah, see, that's a lovely comment. Yeah, that's why you want carbs. Yeah, because your brain feels like you're searching for something, aren't you? You just kind of feel flat. You want to boost. And of course, the other side of treating this is not just that you focus on the right foods to eat. That's the foundation. People should eat high quality proteins and fats as a basis. If they want to add in a bit of this and that, then that's fine as well. But it's not just about that. It has to be about how in your life, in your modern life, are you going to get your dopamine, serotonin, oxytocin, and endorphins in a good way, in a way that isn't going to cause problems like getting it from ultra-processed food or smoking or alcohol or binge watching Netflix or whatever it is. How in your life you're going to kind of, David and I like to think of it like going back, like if you were in the tribe back in the day, what would you have been doing, to feel good? Like, natural things like singing, gardening, walking. I mean, there's so many different hobbies that people could have that would help them. And these are the sorts of things that we've given up in modern life because we're too busy at work, or, we're too tired, or, whatever it is. And we need to, really make these things habits throughout the day to balance the brain chemistry and to keep us feeling good, so that we're not falling back into feeling bad, feeling stressed, feeling tired. Sleep's so important, because all of those things will trigger us back into these food problems or other behavioral problems that are bad for our health. So it's really important to work on those daily habits that keep your brain well. Direct sunlight is really important. Sunlight for serotonin. I think the last lady was talking about serotonin and melatonin. We need to get outside. We need to walk. We need to plug our dogs, talk to the family. There's all kinds of things that we can do to kind of feel better that aren't going to be about relying on food.
Fantastic. Love that. David, passing over to you really quickly. I mean, obviously expert in insulin resistance and inflammation. So we've covered the psychological effects out of food addiction. And again, I mean, Jen, I don't think that gets anywhere near the airtime that it should. This is a massive thing that we should be plugging and pushing a lot more. This is a massive addiction. But coming from the other side now, David, when we're consuming these foods, we're suffering with insulin resistance and inflammation. How can you explain to the listeners how this is damaging to the body and what we can do to repair this?
Yeah. I think the first thing, remember, the whole thing is that a high blood sugar damages the lining of your arteries in hours. We've got a non-stick lining of the arteries to your brain and your eyes and your kidneys. And that is called the glycocalyx. And only a few hours of a high blood sugar damages the glycocalyx. And then against that, let's think about insulin and what it's there for. It's there to protect you and me from a high blood sugar. So insulin reacts quickly to get out of your bloodstream where it could do damage. And it's a good question is, where does the sugar go? And I'm often asking patients, where do you think that sugar goes? And it actually gets turned into fat inside the cells. So some of the sugar is used up, obviously, for running around, but give us consume more carbohydrates than we need to run around. And the extra is turned into fat inside your cells. Gives you a bigger tummy, which, Richard, it sounds as if you had a bigger tummy at one point. But more importantly, the fat increases in your liver. And this is really important. This is the work of Professor Roy Taylor from Newcastle University, where you continue to eat breakfast cereals, rice, potatoes, biscuits, and your liver is filling with fat. And unfortunately, the fat in the liver interferes with the work of insulin, so that you become less sensitive. So your insulin doesn't work as well. And that means that you're less able to deal with blood sugars. So for a while, you're only, if your insulin doesn't work as well, you are forced to produce more insulin. You become hyperinsulinemic. You produce more insulin. But unfortunately, there's a double whammy here, because the pancreas, the gland that produces insulin, is also filling with fat. So your ability to produce more insulin is compromised. And this is absolutely at the heart of how millions of people become type 2 diabetic. So the two problems, one is your insulin doesn't work as well, and the other is producing insulin is a problem. So that after a while, you actually have type 2 diabetes, which means you cannot anymore regulate your blood sugar to within safe levels. And those high blood sugars can damage the lining of your artery, as I told you at the beginning. It's got to a point now, I think it's 38% of the entire, of the developed world have fatty liver. So that's more than 1 in 3 of everybody we know. And I know in the practice, the number of people with abnormal liver function and fatty liver, there are thousands and thousands of patients, and they're getting younger and younger. So one of the main effects of too much carbohydrate in your diet is that all has to go somewhere, and it becomes fat in your belly. It also becomes fat in your pancreas, and somebody just put in the point, yes, there is a connection between hyperinsulinemia and pancreatic cancer. And actually, there is a link between hyperinsulinemia and 8 cancers. So I have seen an increase in certainly colorectal cancer in people who are very heavy. That's definitely happening. And of course, insulin, we talk about insulin and glucose, but it does lots of other things. Insulin is a growth factor. And so this would make sense really around cancer and insulin. So if insulin is a growth factor, you need it for puberty to grow, but it's also part of how tumors can grow. And I'm afraid it doesn't even stop there. In our early work together, Jen and I were really confused and surprised by the improvements in blood pressure that our patients were showing. And I personally found my blood pressure improved. And it took me 2 years to find out what is the link between giving up carbs and improving your blood pressure. And this is it, the answer. So we've known since 1932 that a high carb diet is a high insulin diet, and insulin causes your kidneys to hoard salt. So high carb is high insulin, Your kidneys don't wee out salt properly, and that puts your blood pressure up. And significant improvements in blood pressure for people when they go low carb. I expect most of you noticed when you first went low carb, you weed a lot. You're actually weeing out lots of salt, and it's why if you go keto particularly, you might need more salt at the beginning of the diet, because otherwise you get headaches and keto flu, because suddenly you're weeing out salt you've been hoarding for a while. And Jen and I both have a lot more salt than we used to. I think I've probably said enough now. It's time Jen said something.
Yeah, no, fantastic. Love that. Spot on. I mean, high blood pressure is an insulin dependent state. In states of elevated insulin will pull sodium from 4 points in the nephrons in the kidneys back into the blood. Wherever sodium goes, water follows. This is why we get high blood pressure. A lot of research into the renin-angiotensin-aldosterone system reveals several mechanisms in regards to why we retain elevated sodium levels, but we shouldn't fear sodium. It's not the source of high blood pressure. And unfortunately, it's something else that's been demonized within society. Sodium is in fact essential for life. We cannot live without it. There's a study that I reference in one of the talks that shows when we go below 1,500 milligrams of sodium per day, all-cause mortality increases massively. So sodium is another thing that's been demonized within society, and it's another thing that we shouldn't be fearing. We should be consuming lots of sodium, particularly from natural sources like pink Himalayan and Celtic sea salt. So a fantastic point there on blood pressure. And again, coming back to the insulin.
I often say that, well, it's just a point of true causes of illness that I made at the very beginning. That again, for 25 years, I'm just giving out drugs for high blood pressure without thinking, why do they have high blood pressure? And this demonization of salt is unfortunate. Salt is dangerous in a high carb environment. So it's true. Carbs and salt together give you problems. And of course, just as Jen was talking about, how were we designed? We weren't designed to do in a high carb environment because that didn't exist. This is a very situation, find out, and by saying we're just blaming the wrong crystals. We're always blaming salt for what the sugar did.
Yeah.
I agree.
Can I answer? Shall I answer Rose's point about? So Rose says, how do you feel about being abstinent from sugar and fat? Carbs, is it necessary? And is it possible? So it's definitely possible. So there's absolutely no need for us to ingest any carbohydrate because your liver is just going to make the right amount that you need of glucose, the little bit that your brain needs. And there's one or two other needs that we have. Is about a teaspoon of sugar in your entire bloodstream at any one time. So you can see that if you eat a banana that has about 5 teaspoons of sugar, you've already got too much sugar. And people think things like bananas are incredibly healthy and necessary if you go to the gym. Well, as you can see, that Rich has done very well going to the gym without any carbohydrate. And I do my little old lady boot camp 4 or 5 times a week, and I seem to do okay without any carbohydrates at all. Now, whether it's necessary is more of a kind of individual question. I'd say it's probably a good idea. I don't know why it's probably a good idea to give up sugar if you can. It's basically a poison, so it's never going to do much for you. In terms of how low you have to go in terms of carbohydrate, depends on your goals and also your reaction. So, if you're type 2 diabetic, it's a good idea to go low. But obviously, if you're on medication, check that out first, because we don't want people falling over with low blood pressure or low blood sugars if you're on particular kinds of medication. But from an addiction point of view, again, it's really individual, the foods that people have to give up. And it depends which foods to you are a little bit like drugs. So for many of us with food addiction, we end up giving up all carbohydrate type foods, apart from maybe some, you know, green veg and stuff like that. Other people who perhaps aren't quite as far along the journey, or who maybe the metabolism and they're, you know, they've not got so far, they're not so damaged, they can sometimes cope with a little bit of sweet potato, or, you know, maybe some you know, some things like that. But a lot of us find that we just feel better cutting out all sugars and carbohydrates. So it's a bit of a long-winded question, but it's kind of an individual thing, and it depends what your personal problems are, really, how far you want to go, and see how you feel. Does the liver make sugar in type 1 diabetes? Yes, I think the answer to that is yes. It would have to, wouldn't it, David? Because you need it. Your brain needs a certain amount. So that's part of the problem for them, is they make sugar, but they can't deal with it because they haven't got any insulin. So they have to inject a certain amount of insulin to deal with the sugar that the liver's making. Although I'm kind of answering David's questions here.
Love it. Just to add on to the back end of that as well, I mean, coming back to the insulin resistance, you know, we all know someone who has actively tried to abstain from eating, or at least tells us that they're doing so, and they don't lose any weight, and we think that they are up in the middle of the night stuffing their face with pies and pasties, when in fact they may be telling the truth, because this weight loss is controlled by the endocrine system. It's not calories in versus calories out, and it comes down to predominantly insulin and insulin's role within the body. Coming back to this insulin resistance, that while insulin is elevated, insulin upregulates lipoprotein lipase, which signals the body to store fat, doesn't it? And while insulin is elevated, it's biologically impossible for us to burn that fat for fuel. We need another enzyme called hormone-sensitive lipase to break those bonds on the glycerol backbone to put those fatty acids back into the bloodstream. Now, the issue with someone who is highly insulin resistant is insulin is elevated for such a long time. They may go hours and hours and hours without eating, but insulin is still elevated. They are not burning any fat for that entire time. So someone coming from a state of high insulin resistance is going to take a little bit longer to reverse that. That's why it's critically important to go low carbohydrate. And, you know, everybody is individual. So if you're coming from that state of severe insulin resistance, it may take a little bit longer. But this isn't a diet, is it? You know, we're not teaching about, this is a lifestyle. This is about eating real foods that are having low impact on insulin response, keeping that insulin low, keeping the glucagon to insulin ratio low, so we're able to utilize that fat for fuel. But that's an important factor, I think, with the curve with that insulin resistance, because insulin resistance, you know, we associate that with type 2 diabetes, but type 2 diabetes, so if you go to be tested with yourselves in regards to type 2 diabetes, a person may come back as not being type 2 diabetic because you're testing blood glucose and not insulin, isn't it? So the reality is that insulin may be increased behind the scenes, and you are in fact insulin resistant, because the point that you were diagnosed with diabetes began 10 to 15 years prior to that. So if you have been tested for diabetes through you know, a glucose test, then it's probable that you are insulin resistant. And a way to tell is central adiposity, skin tags, skin irritations. Now, I think that most of us on the high street are highly insulin resistant, and you know, this is why we need to actively look at carbohydrates, foods that are eliciting this insulin response, and foods that are high in lectins as well, also, because I think lectins, they tend to get they don't get the airtime they deserve, but lectins are carbohydrate binding proteins which bind to insulin receptors and signal the body to store 5 times more fat than insulin does itself. And then we've got seed oils, which are high in oxidized omega-6 linoleic acid, which causes insulin resistance, I believe, around 6% higher than carbohydrates, or the effect of insulin does. So there's all of these contributing factors. I've thrown a lot at you there. Do either one of you want to jump in and add or
yes.
part anything I just said?
Well, I just wanted to say, Rose, I think
a little bit about hunger. Oh,
go on then.
Yeah, I'll go first then, and then.
Okay.
There's a delay, so it's a bit difficult. I wanted to talk hunger in the context of what you were saying, really. So I'd summarize it. We are actually a dual fuel engine. So it's genius. We can burn fat or we can burn glucose. Problem, the sting in the tail for insulin is because of insulin's priority to deal with sugar, it prevents you from being able to burn fat. So in a carb environment with insulin resistance, it's very unlikely that you'll be able to burn your fat. And this explains why somebody might be very overweight, but they're genuinely hungry. So they are genuinely hungry. And hunger actually is the problem. People eat because they might be addicted, but they're really hungry. They say they're hungry and they are. Mm. And this is just a point that might interest some people. So if you get your insulin down low enough, then after an adaptation period, which can take up to 2 weeks, you start burning the fat. And then again, in every clinic that I do, people tell me they're suddenly surprised not to be hungry. And they're saying things like, do I have to eat breakfast? Because I just don't feel I have to. And I'm saying, hooray, no, you're burning fat now. You've got fat to burn. And that's what you're about. And I think, I know myself, if I'm feeling really hungry, I've usually something's wrong somewhere in my system if I'm really hungry. So I just wanted to underline what you said around the dual fuel engine and around hunger. And we're talking about keto, and keto is really, that's when you're burning fat and you tend to be less hungry. So I'll shut up now and it's Jen's turn.
No, but I was just going to go back. Rose, yeah, Rose was saying it's so hard, isn't it? I've really sympathise, Rose. It is really hard for those of us who's have got this, you know, this real struggle. And probably, I don't know, like me, you've probably had it since you were born. I can't remember a time when I didn't, you know, just love sugary, carbohydratey stuff. And was kind of thinking about it a lot of the time. You know, some of us are kind of really born with that. So it is really hard. And you've got a support group. So that's superb. That's great. Yeah, just keep trying. Don't be dieting. Don't be sort of thinking that it's about restricting what you eat. Have plenty of your protein and your good fats. Eat on a regular basis. Don't be trying to sort of think of it like a diet. That's my main advice. And then also work on this other stuff in life that's, you know, gonna give you that feel good factor that's not to do with food. Those of us that are food addicts just get obsessed with food and it's all we think about, and we need to force ourselves to exercise and do other things and have other hobbies and you know, get all of that going in life. So I'm just really sympathizing with anyone on here who's struggling with the food addiction. And you know, we're going to be setting up some groups and support groups as well through the PHC, so maybe you can join us as well. You can never have too many support groups.
That's brilliant. I think we'll put a link to the public health collaboration in the description on the YouTube, and then when we put the clips out from this as well, we'll do exactly the same thing. We're going to have to wrap up this section because StreamYard can't do 24 hours in a row. So we're going to have to say goodbye to Dr. David Unwin and Dr. Jen Unwin, and then spend about 5 minutes telling people how to follow us for the next next 10 hours. So,
right. Wow.
So this is the end of this section. But I've learned so much. I love listening to you both. I think you're sort of like a yin and yang. It's quite nice to see your different approaches. It's excellent. Richard, do you want to wrap up? Because you...
Yeah, I thank you both so much for coming on. I don't think the time that we've had is anywhere near long enough. I'd love to do this again with both of you. Maybe we could do a joint thing, Stephen, maybe, you know, for another podcast. But there's lots of information to put out there. I think we've only just scratched the surface, but thank you both so much for taking the time on a Sunday, especially as you're celebrating a wedding anniversary, I believe you said it was. But yeah, thank you both so much. Steve, can we pop the links when we post this? Obviously, this is live, but we're going to post this moving forward. We can pop links to their
yeah. Well, what's going to happen is YouTube will have 10 hours, which I am going to edit down to hours. But there will be one version of this, which will be 10 hours. So just give me a couple of weeks to edit it all down. And it will take a bit of time, but it'll be worth doing. And you'll have all the links. And then I'll try and do some clips of, the main points if I can. But it's going to be a bit of a task. But anyway, I want to thank you just for turning up. But it'll all be out there soon. By the end of July, hopefully, it'll all be there.
Links included. Yeah, fantastic. Thank you both. Massively appreciate it. Thank you both so much. Hope you've enjoyed. Yeah, it's been fun. But thank you guys. Take care, and we'll speak to you soon.
Bye-bye.
Bye-bye.
Thank you both.